It's 2023, and yet we still have barriers in the United States that prevent some people from getting the mental health care that they need. Let's talk about why and ways to improve the situation. Hello there, this is Bradley, and you're listening to Psych Everywhere, a podcast by Psychi, the International Honor Society in Psychology. For this show, distinguished guests weigh in on applying psychological science to a diverse range of current events and to better your life. This episode was made possible through a special Psychi sponsorship with CSPP Alliant International University. If you'd like to learn about graduate programs at CSPP, be sure to check out the link in the show notes for this episode. Although well-meaning, practitioners can sometimes drop the ball when it comes to supporting people of different sociocultural groups. Language barriers, lack of cultural understanding, complex intake forms, biases when accepting new clients. These are all things to watch out for, not to mention the fact that too few mental health practitioners come from diverse sociocultural groups. To provide insights and ideas for moving forward, I'm excited to introduce you to Dr. Ya-Shu Liang, an associate professor and the program director of the Clinical Psychology PsyD program. You guessed it, at CSPP at Alliant International University, Fresno. Dr. Liang is a licensed psychologist and founding director of the San Joaquin Valley API Mental Health Project to increase mental health literacy in Central California's Asian and Pacific Islander communities. She's presented on mental health disparities, microaggressions, and language-based discrimination. Dr. Liang, welcome to Psych Everywhere.
Thank you, Bradley.
So I'm really excited to talk about this, and I've got about 10 questions today. So I'm going to jump right into the first one, which is this. What are some common barriers, and I guess I named a few, but what are some common barriers that can prevent members of some sociocultural groups from accessing quality mental health care?
When I think about it, I think about three things. I think about knowledge, stigma, and resources. So first one is, do people actually know what they are experiencing, or if their loved ones are experiencing maybe signs of mental health issues? They may not know what a therapy session look like. They may not know what kind of treatments are available to them. And so that's about the knowledge, right? So that's the barrier. Sometimes they don't know what they're experiencing is related to mental health. Second is stigma. Sometimes for certain sociocultural group, seeking help might bring shame to their family and friends. So that's a big one. Number three, resources. Some people don't know where to look, and they also don't know if their mental health providers would understand them, especially around the experience of discrimination and prejudice. And also there are limited resources. For some individuals who would prefer to be speaking a different language, doing therapy in a different language, they might be lacking those resources for them. So those are the three main common barriers that can prevent people from certain social cultural groups from seeking mental health.
Could you share any success stories of how people have overcome these barriers?
I primarily train doctoral level students to become licensed psychologists nowadays. But before I worked for CSPP, I worked in various university counseling centers for more than 10 years. So I always have this more of a kind of community psychology approach to things. What I have found is outreach is very helpful. When I showed up at the outreach event at a university, people see me being a psychologist. Psychologists can be very different. They can be coming out to do a depression screening with you. I think that helped to normalize, what mental health services look like and what mental health services providers look like. I find that very helpful when psychologists can go out and do more of those outreach. Second, I have heard a lot of the primary care visit sometimes nowadays will flag potential depression, anxiety, and I have found those very helpful to people who normally would not walk into a psychologist's office, but they got this questionnaire and flagged for depression, and through the referral from the primary care doctors, they are more than likely to come in and seek help. I also find kind of just overall general, kind of like in a society, there are more and more people who are celebrities or people who are in a position of power normalizing seeking help. And so if you have someone who look like you, share they have been in therapy and how therapy have worked out for them, I have found those very helpful to for those individuals, and I've seen those individuals coming in to seek help because of that.
I like the idea of getting out there and finding people and going where they go. I was at the zoo a couple of weeks ago, and they had a little booth set up. They were giving scans or something for people's backs. And I thought, I bet there's a lot of people kind of like me who I know I have some back issues, and I'd never schedule an appointment or go in there, and there they were. And if I hadn't have been carrying a baby, I probably would have walked over there. I thought, this is effective. And I don't really see that with mental health. I don't see people getting out there and talking as much as they could. So you led a paper on mental health private practices websites and their intake forms regarding multicultural content. And I'll put a link to that article in the show notes, but could you share a little about what you found?
Yes. So in this study, we looked into more than 100 private practitioners' website and intake forms that's posted on their websites. And we took a multicultural lens when we analyzed those websites and intake forms. So this is what we found. First, we found that those individual and group mental health practices whose website demonstrate greater sensitivity to diversity and inclusion also tend to have more questions on diversity-related questions on their intake form. And they also solicit those information in a more inclusive way. So, in other words, if you are more inclusive on your website, your intake form tend to be more inclusive. And we also found that the practice that use intake form that ask clients about their strength tend to pay more attention to the diversity questions, and they tend to make their questions more inclusive. As we already know, to work with a diverse population, strength-based treatment work better. And so the fact that we are seeing that on those intake form, they ask those clients about their strengths before they even come into the door is a good sign. Also, overall, we find that there are diversity questions being asked on those intake forms. And the mostly asked are gender, religion, and ethnicity, race. However, in our opinion, it's still a lot of diversity questions being omitted from these intake forms, such as disability, language spoken at home, military experience, or preferred name, things like that. And we also found that some of the questions are not asked in the inclusive way. For example, gender being only given 2 options instead of 3 or 4 or open-ended. And also, for example, spirituality, religion, the question are being framed in a way that is geared towards one certain religion. Things like that. So I feel like, as a field, we still have more work to do to make at least the intake form to be more inclusive.
In what ways might practitioners drop the ball when counseling people of diverse sociocultural groups? And could you share any examples of common microaggressions or failures to connect that occur in a counseling setting?
I really like this question. And I always tell my student, right? When a client comes in to see us, a client is not going to be saying, oh, my therapist is so culturally competent. Usually that's not the case. Usually they would say, well, my therapist really care about me and they have the best intention of understanding me. And so I would say several situations that I would consider, a therapist dropping the ball. First, they did not ask certain questions. For example, in an individualistic kind of culture, we tend to ask what you want to do. We don't ask enough of what other people think of your behaviors. And so sometimes I see that my student would miss asking those questions. Other question that might be missed is immigrant history. So first is basically did not ask certain questions. Second, sometimes if a therapist completely rely on assumptions or stereotypes or completely relying on their clients to teach them about their culture, I see that as also not a good sign. Also, sometimes therapists might make assumptions about the similarities and differences among the therapist and the client, making a lot of assumptions about that and based on their treatment, based on those assumptions. So they might not be good. Another thing is if they did not adapt treatment to the individuals based on their sociocultural backgrounds, identities, abilities, and socioeconomic status, and sometimes it does not work well. The last one is when a therapist did not ask for feedback from the client, sometimes it leads to the failure to connect in those situations.
These days, it seems like everybody's got diversity written somewhere on their LinkedIn or their CV. When choosing a practitioner, though, do you have any tips for how to determine if a practitioner is really serious and actually knowledgeable about diversity topics?
I think when you meet them, if they are welcoming and they are very relational in their approach and they're not afraid of broaching any kind of topics when it comes to diversity and inclusion, and I think that's a good sign. Also, if they're also asking you about your strength instead of a deficit, that'll be great too. And I often tell my student, right, why do clients have to trust you? Like, the therapist can keep saying, this is a safe space. But I feel like when therapists say that, it's only for themselves. It's not for the client, from the client's perspective, right? Prove to me that you are a safe space for me to be able to share things with you. So I think therapists, you don't have to say much, about diversity and inclusion. You only have to show that you really care about how those diversity factors affecting your clients by asking the right questions and thoughtful questions and adapting your treatment to those clients.
What strategies can mental health care providers employ to bridge the gap in care for diverse sociocultural groups?
If you own a private practice or if you are a director of a mental health program, right? I think it's important to hire and highlight providers who are coming from a diverse background and also highlighting the diverse treatment approach and focus on their diverse skills. For example, if some people are, can speak a different language, highlight them. Some people have the specialty in treating LGBTQ individuals, highlight them on your website. So that's the first one. Second one is really to create ongoing consultation groups that's focused on working with diverse groups. So it could be, just a weekly meeting, but I'll focus on talking about diversity and inclusion when it comes to working with clients. That would be very helpful too. And of course, individually, I think everybody should seek out continuing education training opportunities on these topics and to continue to improve.
How could psychology students or faculty or even alumni, how could they actively contribute to addressing these disparities through their roles?
I think that's a great question. I think for students, how about write a paper on this topic? Whenever have a chance, write a paper on this topic. Talk about health disparities. For faculty, infuse these kind of things in their teaching and in all of the courses. In my program, I would say half of our students dissertation topic is on diversity, or they are studying a specific population. So it's highly encouraged in our program. And the faculty are on board, with that. For practitioners, definitely looking into your, practice, right? Is it in your practice? Are there any certain group of people that you never see in your practice? And to understand why, right? Is it because that you don't accept Medicaid clients? And what does that mean for you? And so are you serving the whole range of clients who might be coming from different cultural background, have a different level of ability to pay, right? So I would do an examination on whether that your clientele are diverse and why not.
Could you share any examples that you've seen at CSPP for preparing future counselors to be supportive of different sociocultural groups? I guess that could be classes that they have to take or policy or...
Yes, at CSPP it's easy because CSPP multicultural competency is one of the pillars. And so we are required to actually identify where we address multicultural and international issues in all of our classes. That is a standard part of our practice. So that, to me, our institution is very supportive of this kind of effort. That's already a given. But for us in our own program, of course, we have the cultural diversity courses at the very beginning of our students' training. So we started out talking about, what are your own biases, your own awareness, and your own privilege and oppression, right? And then move on to talk about how to work with individuals coming from a certain group, and also talking about intersectionalities. So that's kind of how my program deal with it in the curriculum level. For our program as a whole, for example, our student body reflect the communities that around us. So in each year, we have about 20% to 40% of the student coming in speaking Spanish. So as a program, to meet the needs, right? And the student really want to learn, we start doing those workshops for Spanish speaking trainees to talk with Spanish speaking psychologists in the community to talk about how you can use Spanish in therapy. And so that's the start of our conversation. It's possible that my program might want to institutionalize this, for example, offering a class and have an experience area develop in the program. We keep thinking about ways to support students of different backgrounds, and I know at least where we are in Fresno, California, definitely we have the privilege of having those students who have multilingual abilities, and we want to continue to support them in our program.
Okay. And I just have one more question, and I kind of like to end with one like this sometimes. It's sort of a why question, right? Like, why does this matter? What is the big goal that we're trying to achieve? So the question is, what are the long-term benefits to society if we successfully address these disparities in mental health care?
We are all connected. Research has shown that one person who struggles in a group is going to affect the rest of the group. So I take more of a community psychology approach, right? Anybody in our community, we want to lift up everybody in the community because we are all connected. And so that's why we address the health disparities, and especially the mental health disparities, and because we are all connected.
You've just listened to another episode of Psych Everywhere. This episode was made possible through a Psychi sponsorship with the Alliant International University, California School of Professional Psychology, that's CSPP. Founded in 1969, CSPP was one of the nation's first independent schools of professional psychology. Today, CSPP continues its commitment to preparing the next generation of mental health professionals and advocates. Their dedication to ensuring every community's access to quality mental health care extends from integrated care to inclusive family therapy. Explore their programs at https://info.alliant.edu/partner-psychi, which is spelled PSICHI. And if that's a bit much for you, I'll put a link in the show notes too. I really appreciated Dr. Liang for joining us today to discuss these mental health disparities, and I hope that you did as well. Would you like to learn more about mental health? Go check out our new mental health awareness online resource. In it, you'll find educational content, details about the Christian Ladd Hall Scholarship for Mental Health Advocacy, and Psychi's Pi for a Purpose Global Service Project, which we launched this year to support that scholarship. You'll also discover steps to mental wellness, ways to take action in supporting mental health, and links to crisis hotlines. And I'll put a link to this resource in the show notes too. Go ahead and follow us wherever you go for podcasts. Tell a friend or a colleague about the show. Word of mouth is a huge help for podcasts. So share what you learned at the dinner table or in your classes. You can also follow us on Twitter at Psychi Podcast and leave a review at Apple Podcast or wherever you go for podcasts. You'll absolutely make my day. And more importantly, you'll be helping us to get psych everywhere. Okay, that's all for now. I'll connect with you again soon. Copyright 2023, Psychi, the International Honor Society in Psychology. All rights reserved.